Hey, so today we're doing traction on our patient, 42-year-old male Jack here, who came in with some cervical, what I suspect is stenosis of the spine. And what we'll be doing for him is, some cervical traction, and some indications for this is his limited range of motion and pain. Contraindications I think we'd have to be aware of would be any surgery or spinal implants he's maybe had in the past, or any inflammation since the injury was somewhat recently. What I'll do for that is just inspect the spine, maybe palpate a little bit, ask about the mechanism of injury, make sure it wasn't like a high impact force that could cause a fracture, and we'll assume I've gone through that assessment and come out with everything looks good to go. And so hey Jack, so today we'll be doing some cervical traction. Should be a good method to relieve a little bit of pressure on your spine. Before we get started, I just want to make sure, have you had any surgeries or like spinal implants on your neck?
No, I haven't.
No? Okay. And then when you injured it, was there any impact force? It sounds like it was just kind of like an overuse type thing.
Yeah, it
like...
just started hurting more and more.
Okay, cool. So if you don't mind, I'm just going to inspect the area just a little bit, check what's going on. So cool. Just break down the cervical spine. Everything feel okay there?
Yeah.
Cool. All right, great. So feel good about the contraindications. So I'll set up the machine, and then I'll get the patient in all locked in. We'll get started. So what I'll be doing is I'll be doing cervical traction and intermittent at about 10 pounds of force to start out with. If seems like it went well, we could move it up to about 15 pounds of force. The time I'm all right with at 15 minutes. I'll just make sure to check up every 5 minutes. And then another key thing to give the kill switch. So that is my setup there. And I think the angle's wrong on that machine. Just looking at it, it looks like way more than 15. Ideally, I was shooting to be around 20 to 30 degrees for the neck position. Alrighty, so there's that kill switch. At any point, if you're feeling any discomfort or feeling like something's wrong and I'm not in the room, you can press that, and then just call for my help as well. I don't expect you to need to use it, but it's just in case it's there for your safety. So next, what I'll have you do is I'm gonna move this down a little bit, and then I'm gonna move this down a little bit, and then if you want to just lay back so the base of like your skull is just resting in those prongs.
Okay.
Great. Is that pretty comfortable there?
Yeah.
Cool. I'm just gonna strap these down. You should feel like a little bit of pressure, but not so much like your eyeballs are gonna pop out of your head or anything. So how's that there?
Perfect.
Feels nice and snug. Okay, and then I'm just gonna tighten these so it feels like it's just supporting your neck, like nice and even.
Okay.
How's that feel?
Yeah, that's good.
Good? Okay, great. So, great. I'll set you up right through there. All right, and you should feel just a little bit of a lifting force, but it should feel pretty good overall. And I'm just going to start that right there. So. All right. Cool. So let it go for about 30 seconds. Again, I'd probably check up every 5 minutes about, especially for patients' first visit, and see how it goes. All right, how's that feeling, Katie?
Feels so good.
Feels good? Okay, great. I'll let you relax and have it do its thing, and Okay, so 15 minutes is up. We'll stop it there. What I'll make sure to do is maybe have the patient relax for a little bit, and then upon getting up, make sure to try and avoid going back into like a forward head position or anything that might cause more compression on the cervical spine. So, all right. Great. So I'm just going to release that, and then what I want you to do is just relax there for a little bit, if that's a comfortable position. And so about after 5 minutes, we'll get you up, and just trying to keep that head nice and neutral, not like flexing forward or back or to the sides too much, if that's okay. So great, we'll assume 5 minutes pass, and we'll get you up. That from you. Great. All right, how'd everything feel?
Feels really good.
Awesome, good to hear.